The current healthcare delivery system in the United States is primarily based on a private, market-driven model with a combination of public and private funding. It is a complex system with multiple stakeholders, including government entities, private insurance companies, healthcare providers, and patients. The system has evolved over time, influenced by historical events and policy decisions. The U.S. healthcare system has its roots in a predominantly fee-for-service model, where patients pay directly for their healthcare services. The rise of employer-sponsored health insurance during World War II further shaped the system. The passage of Medicare and Medicaid in 1965 expanded the healthcare coverage for specific populations such as elderly and low-income individuals. The Affordable Care Act, signed into law in 2010, aimed to increase access to healthcare and improve quality through various measures, including expanding Medicaid eligibility and creating healthcare insurance marketplaces. The rationale for the U.S. healthcare system enactment lies in the principles of individualism, free market competition, and limited government interaction. The private sector plays a significant role in financing and delivering healthcare services, emphasizing personal responsibilities and choice. The goal is to provide access to healthcare while preserving economic freedoms and avoiding excessive government control. The U.S. healthcare system's impact on Americans has been a subject of debate. While the system offers advanced medical technologies, innovative treatments, and high-quality care in some areas, it faces several challenges, such as access and affordability. Many Americans face barriers to accessing affordable healthcare, with the uninsured and underinsured populations being particularly vulnerable. High healthcare costs, including insurance premiums, deductibles, and out-of-pocket expenses, contribute to financial strains and limited access to care for some individuals and families. Healthcare disparities. Disparities in healthcare access and outcomes persist among different racial, ethnic, and socioeconomic groups. Certain populations experience higher rates of chronic disease, lower life expectancies, and reduced access to healthcare resources. Fragmented care. The U.S. healthcare system is characterized by fragmentation, with multiple providers and payers involved in care delivery. This can lead to coordination challenges, gaps in care, and limited continuity impact patients' outcomes and experiences. Emphasis on treatment over prevention. The system has historically focused more on treating acute conditions rather than preventing or managing chronic diseases. Shifting towards a preventative care approach could potentially improve health outcomes and reduce healthcare costs. Now, the impacts on nursing practice, education, leadership, and management. The U.S. healthcare system structure and dynamics influences nursing practice, education, leadership, and management. Nurses play a critical role in care delivery, patient advocacy, and care coordination within the system. However, they also face challenges related to workforce shortages, high patient acuity, and increased administrative burdens. Nurses in the U.S. often work in complex interdisciplinary setting collaboration with various healthcare professionals. They must navigate insurance requirements, documentation standards, and evolving healthcare policies while providing patient-centered care. Nursing education programs strive to prepare nurses to meet the demands of healthcare system. Curricula focuses on evidence-based practice, leadership, and interprofessional collaboration, aiming to develop competent nurses who can adapt to changing healthcare environments. Nursing leadership and management. Nursing leaders and managers face the task of balancing quality care delivery with financial constraints and regulatory requirements. They play a crucial role in driving patient safety, quality improvement initiatives, and workforce management with their organization. The current healthcare delivery system in Canada is often referred to as a publicly funded universal healthcare system. It is designed to provide healthcare services to all Canadian citizens and permanent residents regardless of their ability to pay. The system is primarily financed through taxation and operates under the principle of accessibility, comprehensiveness, universality, portability, and public administration. The history of Canada's healthcare system dates back to the mid-20th century. In 1947, the federal government passed the Hospital Insurance and Diagnostic Service Act, which provided federal funding to provinces and territories for hospital insurance. This act aimed to ensure that Canadians had access to necessary hospital care without financial barriers. Subsequently, in 1957, the federal government extended funding to cover physician services through the Medical Care Act. Over time, the healthcare system evolved with additional federal-provincial agreements, resulting in a universal healthcare system across the country. The rationale for enactment of Canada's publicly funded healthcare system was driven by a desire to provide equitable access to healthcare services for all Canadians. The system was built on the principle of social solidarity, ensuring that healthcare is seen as a fundamental right and not a privilege based on financial means. The goal was to eliminate financial barriers to healthcare and ensure that no individual would be denied necessary medical care due to inability to pay. The impact of healthcare of Canadians and nursing practice. The Canadian healthcare system has several notable impacts on the healthcare of Canadians and nursing practice. Universal access. The system ensures that all Canadian citizens and permanent residents have access to necessary medical services without financial barriers. This promotes equitable access to healthcare across the population. Comprehensive coverage. The system covers a wide range of healthcare services, including physician visit, hospital care, preventative care, and medically necessary procedures. The comprehensive coverage contributes to the overall health and well-being of Canadians. The only thing that isn't covered in the insurance would be the dental and vision. It is important to note that while the Canadian healthcare system has its strengths, it also faces challenges such as wait times for certain procedures and access to specialized care in some regions. These nursing practice and education. Nursing practice in Canada operates within the framework of the publicly funded healthcare system. Registered nurse and nurse practitioners play essential roles in delivering primary care, acute care, and community-based services. Nursing education programs in Canada are designed to prepare nurses to work effectively within the publicly funded system, emphasizing evidence-based practice, health promotions, and primary care delivery. Nursing leaders and managers in Canada navigate the complexities of the publicly funded healthcare system. They work collaboratively with other healthcare professional government entities and policymakers to ensure the effective delivery of healthcare services. Nursing leadership and management in Canada focuses on optimizing patient outcomes, resource management, and quality improvement initiatives. Comparing and contrasting the longevity age between United States and Canada. In the United States, the longevity age would be 76 for males and 81 years for females, while in Canada, that would be 82 years for both males and females. The higher life expectancy in Canada can be attributed to several factors, including universal healthcare coverage, greater emphasis on preventative care, and lower rates of income inequality compared to the United States. However, the multiple factors contributing to life expectancy and healthcare systems alone do not determine those outcomes. The top 10 causes of morbidity and mortality. In the United States, the leading cause of death would be heart disease, cancer, chronic lower respiratory disease, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, kidney disease, and septicemia and accidents. The leading cause of morbidity would be mental health disorder, musculoskeletal conditions, cardiovascular disease, respiratory disease, and diabetes. In Canada, the leading cause of death would be cardiovascular disease, including heart disease and stroke, cancer, respiratory disease, diabetes, Alzheimer's disease, and accidents. The leading cause of morbidity would be mental health disorders, musculoskeletal conditions, respiratory conditions, cardiovascular disease, and cancer. While they are similar in the top 10 causes of morbidity and mortality between the two countries, some differences exist. Both countries face challenges related to chronic disease, mental health, and accidents. However, the higher prevalence of certain conditions such as cardiovascular disease and diabetes in the United States may be influenced by lifestyle factors, socioeconomic disparities, and access to healthcare. What are the impacts of healthcare delivery system? In Canada, with its publicly funded universal healthcare system, Canada emphasizes equitable access to care and preventative services. The system's focus on primary care and comprehensive coverage may contribute to better overall health outcomes and address the burden of preventative disease. While in the United States, the U.S. healthcare system, with a more complex mix of public and private sectors, faces challenges related to access, affordability, and fragmentation. The emphasis on specialized care and treatment may contribute to higher rates of specific disease, but may also result in advanced medical technologies and research advancement.